You're looking live right there. He's taking off his mask. Let's listen to Governor Wolf now.
Thank you all for joining me. Today, 24 counties moved into the yellow phase of reopening Pennsylvania. This plan prioritizes the health and welfare of Pennsylvanians by using a combination of factors to gauge how much movement a location can tolerate before the 2019 novel coronavirus becomes a threat. And I'd like to emphasize that this reopening plan is not a one-way route. We are closely monitoring the 24 counties in the yellow phase, and we will reimpose restrictions if danger arises. We're also watching other counties and are moving them into the yellow phase as soon as we can. So on May 15th, 13 more counties will move to the yellow phase. Those counties are Allegheny, Armstrong, Bedford, Blair, Butler, Cambria, Fayette, Fulton, Greene, Indiana, Somerset, Washington, and Westmoreland. As with the 24 counties that entered the yellow phase today, these 13 counties will see an increasing number of businesses and activities reopen. However, residents should be mindful that yellow still means caution. Every contact between two people is a new link in the chain of potential transmission. And if the new case count begins to climb in one area, restrictions will need to be imposed to prevent local medical facilities from becoming overwhelmed. Meanwhile, we're also looking at nearby counties. And if current trends continue, they should be moving to yellow very soon as well. So Pennsylvanians should continue to make good choices. If you have the choice, go to fewer stores to eliminate the number of store employees you contact. If you have the choice, call or video chat your friends and family instead of risking transmitting the virus. If you have the choice, exercise in a quiet neighborhood instead of a crowded park. If you have the choice, telework instead of potentially transmitting the virus to your colleagues. And this isn't just for the yellow phase counties. Residents of counties that are still in the red phase can also make choices that contribute to lowering the case count. And that will help push the county toward reopening more quickly. Last evening, Dr. Levine and I signed orders extending the stay-at-home order in those counties that remain in the red phase, and an order for those moving to yellow today on May 15th and other days in the coming weeks. We have provided additional guidance for businesses, including child care centers, and an FAQ sheet to help answer questions for those transitioning to the yellow phase of reopening. Ultimately, though, it will be up to each of us individually to make decisions that help all of us get through this crisis as safely and efficiently as possible. Pennsylvanians have done a great job so far at choosing activities that reduce the risk of transmitting COVID-19. And I am optimistic that we will continue on that path. So thank you again, thank you all for your hard work. Now I'm going to turn things over to Dr. Levine for her daily update. Dr. Levine.
Thank you, Governor. And here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,323 new cases of COVID-19. This brings our statewide total to 54,238 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This includes 3,553 positive cases in healthcare workers. This includes 2,122 positive cases in workers within the food industry and 127 facilities statewide. And it includes 10,919 positive cases among residents of 522 long-term care living facilities, which include nursing homes and personal care homes. Tragically, we now have a statewide total of 3,616 patients who have tested positive for COVID-19 and passed away. To date, all deaths have been among adults. The next phase of reopening also impacts dental providers. This afternoon, we have released guidelines for dental health care providers to provide care to patients statewide. This is statewide guidance. Given the nature of how COVID-19 is transmitted, extreme care and caution must be used in treating patients in the dental setting. These guidelines are designed to allow access to this important health care while ensuring that the patient and the dental team, the entire dental team, are protected while performing the treatment. Providers may perform non-aerosolizing, non-urgent, and non-emergent care only if proper personal protective equipment, per OSHA guidance, is available for the entire dental team. If infection control procedures outlined by the CDC and OSHA cannot be followed, then the procedure should not be done. This isn't a return to routine dentistry, but a way to ensure that patients who need care can obtain it safely for both the patient and the entire dental team. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Please use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is always most important for Pennsylvanians to remember, stay calm, stay home, and stay safe. And now the Governor and I are pleased to answer questions.